All right, folks, we're going to start in a second, just waiting for everyone to come in from the waiting room. All right, I think we're good. Good afternoon, and thank you again for joining the daily briefing of the City of Philadelphia's response to COVID-19. Today, all the speakers are again joining us virtually to adhere to social distancing guidelines, and we will begin our briefing with opening remarks from Mayor Jim Kenney. Mayor, you have the floor.
Thank you, and hello again, everyone. This morning, I went over to the COVID surge facility at the Recourse Center, where our leadership team had the pleasure of meeting with one of the nation's leading military commanders, Lieutenant General Laura Richardson. Lieutenant General Richardson is commanding general of the United States Army North. Homeland defense and support of civil authorities in the continental United States are among its core responsibilities. Lieutenant General Richardson is working with the Federal Emergency Management Agency to provide military support to communities in need. She came to Philadelphia and to Temple because she had been told that the surge facility we've established is a shining example of a well-planned temporary hospital in the midst of a pandemic. Her visit is a testament to the hard work and experience of a great number of people in our Office of Emergency Management, the Health Department, and many other partners. And of course, it is a testament to the generosity of Temple University. I've thanked them before for stepping up and allowing the use of the Recourse Center, but I truly can't thank them enough. And we thank Lieutenant General Richardson for her visit. She was a very impressive individual. We hope that what she saw and learned can help the hundreds of other cities and towns whose medical capacity is being tested by COVID-19. 50 years ago this week, Philadelphia added to its long history of being a city of first by hosting the first Earth Week at Fairmount Park's Belmont Plateau. The first Earth Week was a people-powered effort around a collective call to combat climate change. Just like the first Earth Week elevated awareness about the importance of our planet's health, in many ways, the COVID-19 pandemic is elevating the importance of caring for the Earth, both locally and nationally. Locally, we are witnessing a renewed appreciation of our parks, gardens, trails, and public spaces as essential services deeply connected to physical and mental health. Nationally, we are seeing renewed calls to address climate change with the same mass collective action as the COVID-19 response. Prior to the pandemic, the city of Philadelphia, like many organizations around the world, planned a variety of community-focused programs to celebrate the 50th anniversary of Earth Week. In response to the stay-at-home order, the city pivoted from an in-person celebrations for the 50th anniversary of Earth Week to virtual programming. This week, we encourage everyone to take advantage of the virtual Earth Week events by following #EarthWeekPHL on social media. That's #EarthWeekPHL on social media. For a full list of Earth Week events, activities, and webinars, please visit philadelphia.gov/green. That's philadelphia.gov/green. Finally, today, I want to highlight the fact that the city and the Philadelphia Industrial Development Corporation have awarded $9.2 million in grants and loans for the first round of the COVID-19 Small Business Relief Fund. The funding is going to 1,145 businesses to help them continue operations, maintain payroll obligations, and preserve jobs impacted by the spread of COVID-19. The businesses that received awards stretch across Philadelphia, with half located in low to moderate income census tracts. Of those that reported demographic information, 60% of the awards went to minority-owned businesses and 34% went to women-owned businesses. Awards were given to businesses from a diverse set of industries, including food and hospitality, personal services, retail, and many more. An additional 600 small businesses are expected to receive awards in the second round, which will be decided over the next 2 weeks. We'll be sure to share the list of all recipients at that time. Philadelphia's small businesses are the backbone of our city's economy, and they have been severely impacted by the COVID-19 crisis. So I am pleased that through this targeted program, we're able to spread limited resources to help a diverse group of more than 1,100 businesses in neighborhoods all across the city. These grants and loans will provide a much-needed lifeline to some of them. And now I turn it over to Dr. Farley for his daily report.
Good afternoon. The news on the epidemic today is mixed. We're seeing a lower number of cases and deaths identified, but we're seeing continued increases in the number of people with this infection in the city's hospitals. So here's more details. Today, we've identified 339 new Philadelphia residents with the coronavirus infection, bringing us to a total of 9,553 since the beginning of the epidemic. Now, the daily number of 339 is lower than numbers we've had before. It's not clear if we have all the laboratory reports today, and our data does come in batches. So that's a number that we should be watching closely this week to see if there are consistent decreases in that. If that were the case, that would be good news. If you want to follow the trends on this, check out the graph on our website. Now, we're continuing to see clusters of this infection in congregate settings, including nursing homes and behavioral health facilities, any places where a lot of people live together, and as well as the city's jail. Update on the city's jail clusters, we now have 56 inmates who are testing positive. That includes 3 new positives since the last time we spoke, but 3 others have recovered. Put that into context, though, there are about 3,800 inmates in the city's jail, so 56 out of 3,800 right now. The number of deaths we've identified that are new since last time we spoke was 5. That's a lower number than we've had in the past. No death is something we want to accept, but it's good to see lower numbers. It brings us to a total of 370 deaths confirmed from the coronavirus infection since the beginning of the epidemic. Again, though, our data arrives in batches, and so we may very well see higher numbers in future days. If you want to have a better sense of trends, check out the graph on mortality on our website. Of those people who died, of the 370, 193 or 52% are in nursing home residents. Now, as far as our city's hospitals, the cases there continue to grow. This morning, there were 923 patients with coronavirus infection in city hospitals and 1,737 in the hospitals throughout the Southeast Pennsylvania region. That number is still increasing. In fact, it's about doubled in the past 2 weeks. Some of the hospitals in the region are near capacity, and some of them are short on staff. So some transfers occurred between hospitals over the region to balance out the load. And if it's necessary, the Recourse Center, which the mayor talked about earlier, is available and ready to help. Thought I'd just back up a little bit and talk about the Recourse Center because we haven't talked about it too much here. So what's happened is over the past 3 weeks, medical experts that are local and people from the Office of Emergency Management have transformed an arena into a field hospital, specifically for patients with the coronavirus infection who are past the worst phase of their disease, but are not ready to go home yet. These are patients who don't need ventilators, but need medical supervision, and they may need oxygen. They can stay up there up to 5 days. And the facility is staffed by doctors and nurses and respiratory therapists and medical experts of all types, whatever needs they have. That staff is a combination of Medical Reserve Corps volunteers, that would be medical staff from around the region who just volunteer their time to assist in the time that we need that, as well as contracted staff, and probably supplemented by staff from the military that you heard about earlier with a visit from the general. The patients there will get 24-hour care. They get medications. They get oxygen if they need it. They get access to testing as needed. Now, patients get there if a physician at another hospital that is under strain requests a transfer. And this would generally be for a hospital that is at near capacity or a hospital that's short-staffed. And that frees up staff for them to take care of sicker patients that need to stay at that hospital. In order for patients to be transferred there, they have to meet the medical criteria where we feel it's safe for them to be transferred and cared for in a field hospital like this. Also, I just want to emphasize, this is not a testing facility. So don't go there expecting a test. And it's also not an emergency department. So I wouldn't want anybody to show up at the Recourse Center expecting care. If you are sick with this illness and you want care, call your physician or go to a hospital emergency department and they'd be happy to help you. Just a little bit update on testing for people interested in testing. We're still limited on how many tests we can do by the number of swabs we have to collect the samples, by the number of chemicals that the laboratories have to run those samples, and by delays in reporting from some laboratories. Nonetheless, testing is still available on a limited basis. And if you want to know whether you should be tested or where to be tested, go to our website, www.phila.gov/COVID, and there'll be background on whether you should be tested and links and phone numbers for where you can go. Now, the big picture here is the hospital data says that we're not necessarily past the worst of this. With the limits on testing, we don't know who's infected. So you have to assume anybody that you run into is infected. So stay home. Still, it's the same message, stay home. If you have to go out, say you're an essential worker, you have to go to the grocery store, keep your distance from people, and wear a mask. And again, our website is www.phila.gov/COVID. Phone number 1-800-722-7112 can answer any of your medical questions. Thanks.
Thank you, Dr. Farley. And just to quickly clarify, the URL that the mayor read earlier for Earth Week information is phila.gov/green. And now Armando will provide the Spanish language translation.
Mensaje del alcalde Jim Kenney para el lunes 20 de abril del 2020. Buenas tardes a todos. Esta mañana fui al Recourse Center, donde nuestro equipo tuvo el placer de reunirse con uno de los principales comandantes militares del país, la Teniente General Laura Richardson. La Teniente General Richardson es la Comandante General del Ejército Norte de los Estados Unidos. Entre sus principales responsabilidades se encuentra la defensa de la patria y el apoyo a las autoridades civiles en los Estados Unidos. La Teniente General Richardson está trabajando con la Agencia Federal de Manejo de Emergencias para proporcionar apoyo militar a las comunidades necesitadas. Ella vino a Filadelfia y a la Universidad de Temple debido a los comentarios positivos acerca del hospital de campaña que hemos establecido ahí. Su visita es un testimonio del arduo trabajo y de la experiencia de un gran número de personas de nuestra Oficina de Manejo de Emergencias, del Departamento de Salud y de muchos otros aliados. Le agradecemos a la Teniente General Richardson por su visita. Esperamos que lo que ella haya visto y aprendido pueda ayudar a otras comunidades y a otras ciudades cuya capacidad médica está siendo puesta a prueba por esta crisis sanitaria. Pasando a otros temas. Hace 50 años, esta semana, Filadelfia sumó a su larga historia de ser una ciudad de inicios al organizar la primera Semana de la Tierra en el Belmont Plateau de Fairmount Park. La primera Semana de la Tierra fue una iniciativa impulsada por los ciudadanos en torno a un llamado colectivo para combatir el cambio climático. Así como la primera Semana de la Tierra elevó la conciencia general sobre la importancia de la salud de nuestro planeta, en muchos sentidos la pandemia del COVID-19 está subrayando la importancia del cuidado de la Tierra, tanto a nivel local como nacional. En respuesta a la orden de permanecer en casa, la ciudad pasó de las celebraciones en persona por el 50 aniversario de la Semana de la Tierra a una celebración virtual. Esta semana alentamos a todos a aprovechar de los eventos virtuales de la Semana de la Tierra, siguiendo el hashtag EarthWeekPHL en las redes sociales. Para obtener una lista completa de los eventos, actividades y seminarios de la Semana de la Tierra, visite fila.gov/green. Esto es fila.gov/green. Finalmente, hoy quiero resaltar que la ciudad y la Corporación de Desarrollo Industrial de Filadelfia han otorgado $9.200.000 en subvenciones y préstamos para la primera ronda del Fondo de Ayuda COVID-19 para las pequeñas empresas. El financiamiento se destinará a 1.145 pequeñas empresas para apoyarlas a continuar sus operaciones, mantener sus obligaciones de nómina y preservar los empleos afectados por la propagación del COVID-19. Las empresas que recibieron financiamiento están ubicadas a lo largo de la ciudad de Filadelfia, y la mitad se encuentra ubicada en sectores de ingresos bajos a moderados. De aquellos que presentaron información demográfica, el 60% de los recursos fueron asignados a empresas de propiedades de minorías y el 34% para empresas propiedad de mujeres. Se otorgaron fondos a empresas de un conjunto diverso de industrias que incluyen alimentos y hospitalidad, servicios personales, venta minorista y muchos más. Se espera que 600 pequeñas empresas adicionales reciban fondos de la segunda ronda, lo cual se decidirá en las próximas 2 semanas. Vamos a compartir entonces la lista de todos esos destinatarios en ese momento. Las pequeñas empresas de Filadelfia son la columna vertebral de la economía de nuestra ciudad y se han visto gravemente afectadas por la crisis del COVID-19. Por lo tanto, me complace que a través de este programa específico podamos distribuir recursos limitados para ayudar a más de 1.100 empresas en toda la ciudad. Estas subvenciones y los préstamos que se proporcionarán son recursos muy necesarios para alguno de ellos. Y esta es la actualización en materia de salud al día lunes 20 de abril del año 2020. Desde ayer se han confirmado 339 nuevos casos de coronavirus en Filadelfia. Actualmente tenemos un total de 9.553 casos en la ciudad. el recuento total de casos reportados es un poco menor. No está claro si hemos recibido todos los reportes de los laboratorios, sin embargo, pero la ciudad está monitoreando de cerca toda esta información para revisar si es que hay una disminución real. Tenemos 3 casos positivos del COVID-19 entre los internos, con un total de 56 casos registrados entre ellos. Reportamos tristemente también 5 nuevos fallecimientos en Filadelfia. Hay un total de 370 personas que han muerto por el COVID-19. 193 muertes o el 52% ha sido en hogares de ancianos. Hay que recordar que este virus no discrimina por raza o género. Los hospitales están siguiendo los casos cercanamente. Hay 923 pacientes hospitalizados en Filadelfia y 1.737 en la región sur de Pensilvania. Los casos de pacientes hospitalizados siguen aumentando y algunos de los hospitales en la región están cerca de su capacidad máxima o están cortos de personal. El Recourse Center está recibiendo pacientes y durante las últimas 3 semanas hay expertos médicos que convirtieron este espacio en un hospital de campo. Este espacio está diseñado para pacientes que ya han pasado la peor fase de la enfermedad y que no necesitan ventiladores, pero sí supervisión médica y oxígeno. Los pacientes que están siendo transferidos de este centro es por pedido de un hospital cercano que esté en su máxima capacidad o falta de personal. Este lugar no es un centro de pruebas o un departamento de urgencias. Les rogamos a las personas no acercarse ahí a pedir ayuda médica. Por favor, consulte con su médico de cabecera o visite el departamento de urgencias de su hospital local de ser necesario. Las pruebas que tenemos están disponibles, pero aún son limitadas. Hay disponibilidad limitada de hisopos para poder recolectar las muestras. Y los datos que obtienen los hospitales nos indican que todavía no hemos pasado la peor parte de esta crisis sanitaria. Con la disponibilidad limitada de pruebas, no sabemos aún quién está infectado y quién no. Por lo tanto, tenemos que asumir que cualquier persona lo está. Puede usted encontrar mayor información sobre los centros de pruebas visitando fila.gov/COVID-19 bajo la pestaña FAQ. Tenemos que acatar la medida de permanecer en casa para estar seguros, porque el virus sigue circulando en nuestro ambiente. Si no respetamos la orden de permanencia en casa, el virus se propagará rápidamente. Si debe salir, le recomendamos mantener la distancia social de 6 pies, lavarse las manos y usar máscaras de tela en lugares públicos donde sea difícil cumplir con las medidas de distanciamiento social. Le invitamos a consultar el sitio web para mayor información www.fila.gov/COVID-19. Recuerde usted que puede llamar al 311 si tiene preguntas sobre el COVID-19. Hay servicios de traducción disponibles en 100 idiomas. Y si tiene preguntas de carácter médico, puede usted llamar las 24 horas del día, los 7 días por semana, al 1-800-722-7112. Y esta llamada es gratuita. Gracias.
All right, thank you, Armando. Before we move to the Q&A portion, Managing Director Brian Abernathy had a quick update.
Hi, all. We were informed as we started this press conference that we have accepted our first patient at the Recourse Center. And so we wanted to provide that update for you before we started to take questions. I think Dr. Farley did a good job of explaining exactly how the Recourse Center will operate, but wanted you to be aware it is open and it has accepted its patient.
Thank you. Please remember, as always, we have limited time during these briefings, so only one representative from each media outlet is permitted, and reporters are asked to limit their questions, at least for the first round, to 3 or fewer, and we will do a second round of questions if time permits. We're going to start off today with Mitch Blocker of NBC 10.
Thank you. Mr. Mayor, I wanted to ask you a question about the city's finances. You've said that we're in a pretty precarious situation in terms of the city's finances. I wonder which city services are safe? What can't you cut?
I'm not going to have that discussion here. Obviously, public safety is very, very, very important to us, but I'm not going to get into which department, how many people. That'll be laid out when we have an opportunity to present the new budget and also have an opportunity to brief council because they're the ones that have to vote on it.
Your largest expense is payroll. How will you prioritize which city employees may need to be laid off?
You just asked me the same question a different way. We're not prepared yet at this moment to lay that out until we have a chance to put our thoughts together in a proposed budget and brief council, and then we'll lay it out to the public.
I'm asking how you may consider that, what your thought process might be.
My thought process is collaborative with the rest of the government and the people who are running each individual department. They've been asked to do certain things and to present certain scenarios, and we'll decide on which scenario we're moving with relatively soon before on May 1st.
And on Friday, you wrote the president asking for his help. Are you concerned in any way that your past political critiques of his policy or actions may impact his response?
No, first of all, it's not his money. It's our money. It's taxpayers' money. And a lot of this is worked out by formula. We should be in line with the formula as every other major city that has this issue. I don't think the president has the ability to change that formula and to slight people or to punish people. And I would hope that he would not act in that way. There's an election coming, and we can deal with that part, the political part, closer to the election. But right now, this is a serious medical emergency, and I doubt that the federal government is going to play around like that.
Great, thank you. Next up is Annie McCormick of 6ABC. Annie, you there?
Hi, Mike. Thank you. Yep. Can you hear me?
Yep. Go ahead.
Okay. I have two questions. The first one is, Brian, can you elaborate a little bit, or Dr. Farley, on the first patient at the Recourse Center, obviously within privacy guidelines, but I'm wondering what the age of the patient is, what condition they're in, and if they came from a hospital or potentially from another, possibly senior care center, nursing home.
So all the patients who...
Go ahead,
Brian.
Tom. No, go you first.
All the patients who go to the Recourse Center are going to be coming from a hospital. They're not going to be coming from nursing homes. And all of them are there because they have coronavirus infection. We're not going to be giving demographic information on them in the interest of privacy of those patients.
And what about age?
Like, we're not going to give them their age, their race, their sex, their names, any of that.
Okay. My second question is for Brian or for the mayor. It's in regards to retail businesses in the city. Today, there was just a burglary of a jewelry store in Germantown. Last night, Vince, which is a higher end retail store at 17th and Walnut, was burglarized. Joan Shep was burglarized in March. So my question is that a lot of these businesses that are sitting here are vulnerable at this point. And I know we've talked about that there's more police on the streets because you've taken people that aren't uniformed and put them out there. But can you elaborate a little bit, Brian or the mayor, about what you are doing to at least make these business owners feel better? Or have there been any conversations or police plans that have been outlined to them?
Brian, you go first.
Sure. So we haven't had a conversation with all of our retail businesses across the city, and I think it is something that we should do, and I appreciate that comment and question. I think as far as it relates to specific plans, the deployment plans for all of our retail and commercial corridors are strong. We've increased again, not just the officers, but actually the number of patrols. But as you said, as there is going to be crime that's happening, and I think it's important to recognize that retail crime is actually down throughout the city as well. So while we certainly have specific incidents we can all point to, many of those incidents happened or would have happened regardless of the pandemic and our current posture. But we certainly should have a broader conversation with our business corridors, and we'll certainly make that happen.
And just a quick follow-up to that, Brian, what are you seeing in regards to the type of crime that's happening in the city at this point? You're saying that burglaries are down at this point?
Yeah, so most property crimes are down. Actually, all property crime is down. What we have seen an increase in is robbery or burglary with a gun and assaults with guns. So those numbers are up, and we believe that's likely crimes of opportunism. And again, encourage everybody to continue to stay inside unless you have to go out. But overall, our property crime is significantly down.
Thank you. That's all I got.
All right. Thank you, Annie. Next up is Denise Clay of the Philadelphia Sunday Sun.
Get your mask on.
Hi.
Stay protected.
Hold on just a second.
And
my question concerns homeless shelters. My understanding is that homeless shelters have been exempted.
Denise, you have to mute that other noise. I'm going to come back to you after you mute that.
Okay. Okay. Well, I thought I did, but.
Sean Walsh of the Inquirer.
Thanks very much. This question is for Mayor Kenney. Can you share your thoughts on the protests in Harrisburg and elsewhere in the country urging Governor Wolf and other governors to reopen state economies?
I think they're short-sighted, and if I've seen some of the video from Washington, D.C., not Washington, D.C., but some of the other state capitals, people are not practicing social distancing. They're kind of together, breathing on each other. And even though I understand people's right to express their views and First Amendment protections, you don't have a right to get infected or be infected and then go to a place and infect others. And I just wish people wouldn't do that. I understand the concern. It's very stressful, but doing that activity with on and not social distancing is really dangerous and very reckless.
Thanks. And just on the issue in general, what they're asking for?
Yeah, we all want to get back to normal. There's no doubt about that. But unless we get back to normal in a very thoughtful way, we're going to make this worse by getting together and then getting groups of people together and then having something happen in July, August, September, which puts us further behind than we are today. So I understand people's concern, and we have to stay disciplined and we have to stay strong to the program that we want to lay out so we can get to a place where we're open.
Thanks. And Brian, when you say the Recourse Center has accepted its first case, is there exactly one patient there, or is there a number there now?
I don't know. We were expecting to receive a couple of additional patients today. I don't know what that intake has looked like, but I think over the next 24 hours, we're likely to see a half a dozen or more patients in the coming days.
Gotcha. And lastly, for Dr. Farley, with nursing home deaths or nursing homes continuing to make up half of the deaths in Philadelphia, obviously you guys are working with them now and were before this became a big issue here. But in an ideal world, or after this and looking back, is there something you would do to change the way that nursing homes operate? Or, if we could do it all over, how would it be set up to avoid this reality?
It's not over yet, and we have to think about the future of this. The risk to nursing homes is going to exist as long as this virus is out there. Clearly, that's the place that's most susceptible to severe infections of any place. Nursing home industry is frequently has people who are not paid very well, may not have full training in infection control, may not have all the supplies that they need. And we've done what we could to give them the supplies that they need and give them training as to how they can control the infection within the facility. But it's a limit given the structure of those facilities. So I think we need to think about over the long term how we do better than that, how we really up the the quality of the work and the attention to the detail in those facilities in order to protect those most vulnerable people.
Thanks very much.
Thank you, Sean. And now let's go back to Denise Clay of The Sun. Let's try that again.
Hi, everyone. Can you hear me?
Yes, go ahead.
Okay, my first question regards the city and the governor's mask order. We're getting an activist sent me a picture of a homeless shelter this morning that he said they had gotten notice that homeless shelters were exempt from the mandatory mask order. I wanted to find out if that's the case, and if so, why?
So homeless shelters they are part of the government, and so that they may consider themselves exempt under that thought process. However, we have asked all of us city contracted shelters to wear masks for both their staff and their customers. We recognize that some of their customers may refuse to wear masks, and in that case, it is very difficult to turn people away for life-sustaining shelter and food because they won't wear a mask. And we're trying to work through that very complicated issue with thought and with understanding, given many of the needs this population has.
Are there going to be masks made available for homeless shelters? Are there being masks made available there right now?
So there are masks available. I actually have asked our Office of Homeless Services to make sure that they've updated whatever personal protective equipment requests that they have to make sure that we can make deliveries back to the shelters as appropriate.
Okay, and I guess this question is for Dr. Farley. What exactly, if you know it, is the setup for PPE and protective equipment in the city's jails? How is social distancing being handled? Is it being handled? Because we're also hearing from folks in jails that it's not necessarily being, that there's no way to social distance and there's not necessarily access to stuff to wash your hands and stuff.
I think, Brian, do you want to handle the specifics of how things are being handled in the city jail?
Sure. So as I think I've said before, it is difficult, if not impossible, to social distance within the congregate care facility that is our jail. We recognize that, but every inmate and guard and correctional officer and staff have been provided personal protective equipment. They've all been provided cloth masks to wear, and remember that my mask protects you and your mask protects me, and that stays true in that facility as well. Now, they've also been provided. Inmates are also provided sanitizing wipes to be able to wipe down the surfaces within each cell. We do not provide hand sanitizer because of the access to alcohol and some of the challenges that we have as it relates. And so I think we are doing what we can to make sure that we're following guidelines to make sure our inmates and staff are protected, given the difficult living situation that is going to be the jail, and has been seen to be jails all over our country, not just in Philadelphia.
All right, thank you, Denise.
You're welcome.
And next, Pat Loeb of KYW.
Can I just follow up on what you said to Denise? You don't provide hand sanitizer because of the alcohol in it? Is there a way to distill the alcohol out of hand sanitizer if you're in a jail cell?
So hand sanitizer, the reason the hand sanitizer works is because there's alcohol in it, and alcohol, that's what kills the germs. And Dr. Farley will be able to answer that question better. If you drink it, it's very bad for you. And our long-going policies for the jail, not just our correctional institution, but correctional institutions across the country, is that we don't provide products with alcohol in them to inmates.
Okay, I don't want to belabor this, but has there been an incident of someone drinking hand sanitizer?
There have been, not recently, because again, we haven't provided hand sanitizer, Pat. So, again, we are doing everything we can to make sure that we provide soap and water, which again is actually more effective than hand sanitizer, as well as sanitizing wipes in order to make sure that people can wipe down their cells. And again, taking every precaution that we can with our inmates.
Okay, thanks. And I had one more question about the early release of prisoners. So Movita Johnson-Harrell was in that group, and she said her temperature was taken before she was released, but it turned out that she actually had the virus, even though she didn't have a fever. She later tested positive within days, within a small enough window that she thinks she brought it home with her. Is there any consideration of testing people before they're discharged from as you say, a congregate care institution where there's no opportunity for social distancing?
So we're following CDC guidelines, which is to indicate that we need to preserve those tests for our healthcare workers and first responders, and only to test those that are symptomatic. And that is the guidance that we're currently following. And certainly, I am certainly aware of Movita Johnson's concerns. I wish her best on her recovery, but certainly would note that there's no evidence that she actually contracted the illness within the jail itself.
Okay, thank you.
Thank you, Pat. And next we go to Jack Tomzik of Metro.
Thank you. the district attorney on Friday, I believe he said there's been an uptick in commercial burglary. So are you guys seeing something different where there's actually been a decrease in commercial burglary? Did I hear that right?
At least the numbers I looked at late last week has not shown an increase in commercial burglaries. Again, we have said that there's been an increase in burglaries with a gun, but not in commercial burglaries. I'll go back and look at our numbers to be certain. I would certainly have the same questions.
Right. Thank you, Brian. And then this one's for Dr. Farley. Which hospitals in the region, are you allowed to say what hospitals in the region have had to transfer patients?
The hospital have asked us not to identify individual hospitals, and the hospitals that may transfer is going to probably change over time.
And, you talked about how some hospitals have had to, hospital to hospital transfers. Has that been a large scale thing, or has it just been, a handful here and there?
My understanding it's been a fairly small number of patients.
All right. Thank you.
Are you good, Jack?
Yes.
All right. Thank you. We go next to Michaela Winberg of Billy Penn.
Hey, everyone. My first question, I think, is for Brian. Is the city going to release a list of the businesses that received the relief grants?
I'm actually gonna have to get back to you on that, Michaela.
Okay.
On whether it's a full list of businesses or not. Hopefully by the time this press conference ends.
Okay. And for Dr. Farley, will the health department start publishing the number of tests that have been done in the city total, including those that come back negative?
We're not trying to hide that. If you want, we'd be happy to send it to you. We took it off the website because we didn't think people were interested, but if you want, we'd be happy to send it to you.
Okay, thank you. That's all.
Great, thank you, Michaela. We're going to go now to Andy Metzger, who is a freelancer.
Hey, Andy, before you ask your question, I promised Michaela I'd get her an answer before the end of the press conference. And yes, we will release the full list shortly.
All right.
So my
Andy, you're up. Go ahead.
Great. There's a story out of New Jersey, Montclair, New Jersey, about a landlord who was able to give his tenants, I think he has 11 commercial and residential tenants, 3 months of rent-free living. And I was wondering, is anyone at City Hall aware of any landlords in Philadelphia that is doing anything similar?
I mean, it would be no anecdotal information. There could be landlords who are doing that, and God bless them. But I'm not aware of any specific program or group of landlords that are doing this.
Got it. And is there anything that's being done either through financial institutions or through some sort of government program that would enable landlords to extend this sort of leeway to their tenants?
I mean, some of the things we're asking for from the federal government are mortgage relief and rental relief and student loan relief. We don't have the capacity here with our economics, our revenue to do that. But we would encourage the federal government to expand these recovery dollars as much as possible to reach people who are lower income scale that are truly suffering.
Okay, thank you.
All right, thank you, Jack. Thank you, Andy. Next, we go to Yaima Crespo of Telemundo.
Hi, la pregunta es para el Departamento de Salud y es sobre qué medidas se están tomando para aquellas personas indocumentadas o que no tengan seguro médico puedan accesar estas pruebas, hacerse la prueba.
The question is for the health department and what measures are being taken to ensure that undocumented citizens or those without health insurance have access to testing.
People who are undocumented have the same access to testing as anybody else. They can go to the test sites. They can, get tested if they have the appropriate symptoms, the appropriate age. And they'll get the result back just like anybody else. No one is asking for documentation status as part of that.
Vamos a decirles que los requisitos son los mismos para cualquier otra persona, es decir, que se apersonen a los sitios de prueba para ser examinados si tienen los requisitos en cuanto a la edad y los síntomas.
Y las comunidades minorías están siendo impactadas severamente. ¿Qué planes hay para abrir algunos de estos centros de prueba en sitios como Kensington o lugares donde hay una gran población de minorías.
We have seen that minority populations are being struck enormously by this virus. What plans are there, if there is any, to open up other testing sites in sites such as Kensington or minority sites?
Well, as I pointed out, there is limited availability of testing. We would like to do much more testing, but there's only so many swabs that we have and only so many samples laboratories can handle. We're looking at opening up additional testing sites through community health centers. We'll see if we can make that happen. But there's limited availability of testing for everybody across the city. And until we get more supplies and more laboratory reagents, that's going to continue to be the case.
Queremos reportar que hay una disponibilidad limitada de insumos y de hisopos para tomar muestras y de capacidad de procesamiento de pruebas. Nosotros vamos a querer abrir nuevos centros de prueba en los centros comunitarios según tengamos mayores recursos.
Y por último, para el alcalde, ¿cuáles serían los servicios que se verían más afectados o más recortes si no se reciben los fondos federales que han pedido?
And this question is for the mayor in regards to the city services that would be affected if there were cuts or there were not funds forthcoming from the government at the federal level. What services would be affected?
Again, it's a question that will be played out as we finalize our revised budget. Not at liberty at this point or have the ability at this point to say exactly which departments are going to be touched because we don't know how much we're getting and when we're getting it. So I understand people's concern about it. It's not going to be pleasant, but I don't have any specifics for you as we sit here.
Esa respuesta va a depender de nuestra revisión del presupuesto final que tengamos. No vamos a poder saber si son afectados y en qué categorías, pero tampoco vamos a saber cuánto dinero se va a poder rediseñar o redistribuir. Y por lo tanto, entiendo que hay preocupaciones, pero por el momento no podemos dar datos específicos.
Muchas gracias. Es todo.
Great, thank you. Now we go to Jason Peters of Philly Weekly.
Hello. My first question is that in Ohio at the Marion Correctional Institute, they tested the entire facility due to increasing positive cases of COVID. 73% of the inmates were COVID positive. Is there any plan to test asymptomatic inmates in Philadelphia's prisons?
Again, not at this time. We are following CDC guidelines about testing people who are showing symptoms and preserving our test results for our healthcare workers and first responders on those who are over 50.
Okay, following up on that, harping on the lack of tests available in general, what is the biggest hindrance in acquiring new tests for the city of Philadelphia?
So, we have two things that are in short supply. One of them is the test swabs themselves, which is what I talked about on Friday. The other is the chemicals that the laboratories use to run those tests. Those are called reagents. So, for example, many of our tests in the city are being run by hospital laboratories. And we had a hospital laboratory last week that said they only had enough of those reagents to last them another 2 days. And those hospitals have to test their patients, their staff, as well as community members. So this is a severe shortage for two different things, and we need both of them in order to greatly expand testing.
Okay, and my final question is for Brian. The cloth masks that you mentioned earlier, and an inmate relayed to me that they were actually making those cloth masks out of the materials that are used for the sheets in the prisons. Could you confirm that for me or deny?
Yeah, so a lot of the masks that you use in the prisons are being made at the prisons themselves. And again, a cloth mask is what we're recommending for everyone that's out in public. Again, my mask protects you and your mask protects me. But yes, some of those are being made on site.
Okay. All right. That's my 3.
Great. Thank you, Jason. Next up, Manny Smith of CBS 3.
A few questions from my team today. Brian and the mayor, I know you guys have made clear about your feeling that you don't want to release municipal worker numbers. However, we saw a message from the police talking about the death of a active police officer on Saturday. And regardless of cause of death, it's saying it's the 7th active officer to die in 5 weeks. Can you guys confirm that last statistic and any reaction to even just morale of the police having to deal with all of that on top of the COVID stuff?
Mayor, I don't know if you want to start or if you want me to.
Yeah, you start, because I wasn't aware of the last.
This has been an incredibly challenging few months for the police department, and I think we've lost a number of active duty officers over long illnesses, some related to cancer. We lost another due to a massive heart attack, and my heart just kind of reaches out to those families and to our officers, and just shows again how committed they are to our city, how committed they are to our residents, and because they're still showing up to work. And so despite the huge challenges they're facing, despite the violence that they encounter every day, despite the human tragedy they encounter every day, they continue to put themselves on the line. Their families continue to sacrifice for us, complete strangers. And I got to tell you, our firefighters, our police officers, our healthcare workers, what they're doing in the midst of this crisis is absolutely amazing. And they are people that we should never forget and thank from the bottom of our hearts for the work that they do in our community.
I think a similar situation exists with our people working in hospitals. I mean, as I said before, many of them young men and women who are nurses and doctors are going into these facilities every day, knowing quite well what faces them. I'll go to another level. If our sanitation workers, for example, are working every day, disposing of trash, they're not sure what's in it, and trying to stay safe and stay healthy. At the same time, get the municipal trash up so we don't have additional health problems as a result of trash laying around. So every single department I recognize, police, fire, EMTs on the front line, extremely dangerous, confronting violence. But every city worker does their part to get us through this, and we love them all, and we're going to do our best to keep them safe.
Same here on that. 7 officers in 5 weeks. I'm just confirming that that's a reportable statistics, that there were 7 officers lost in 5 weeks.
I'll need to get back to you on the numbers. I believe that's accurate, but I want to confirm and don't make a mistake on that. So we'll have Mike or Kelly follow up.
All right, no problem. Our second question is the Governor Wolf signed a number of measures today, probably during when your conference was going on, one of which allows for the restart of construction statewide on May 8th in a limited sense. They're being framed as the first steps to reopening Pennsylvania's economy. As far as Philadelphia and the things you guys are in control of, what does that date sound like? And is there a similar timeline or a date you may have in mind for things to start to reopen from the city point of view?
The southeast region of Pennsylvania has different challenges than a county in central Pennsylvania or the northern tier. So I don't suspect that on May 8th there's going to be a light switch flipped and everything goes back to normal. We've been in conjunction with the county leadership around us, around Philadelphia, and the Philadelphia government have been working and discussing every day with them what their needs are. We've articulated that to the governor as a group. And the governor recognizes, after I've had a couple of conversations with him, and I think he knew it beforehand, that the southeast region is certainly different, more compact and more dense than other parts of the state, and we'll have to roll this out based on all those factors.
And our last question for today is: there's been a consortium of Black doctors working on getting testing at Black churches. We heard today they may have run out of some tests at Enon Tabernacle Church or got to the limit. You guys have talked extensively a number of times about the outsized impact on the African-American community. For initiatives like that, any chance of additional city support or working with them directly to expand testing availability?
Doctor, you could expound on this, but I'm not sure what the standards are. Are they testing everybody, or are they just testing folks who are exhibiting symptoms? People over a certain age. I don't know the details. That's not a site that we're directly involved in, and we need more information unless Doc has it now.
I don't have information on who they're testing, and I appreciate the fact that they want to make more testing available. But again, testing is we don't have enough availability citywide, and so we are in a position where everybody's frustrated they don't have more access to testing. To me, it makes more sense on a continuing basis to have that be a fixed clinic site, so people who need to be tested know what numbers to call, where to go. And if there's a positive test result, they know how to get that test result. If it's positive, they need to talk to the physician, then they can talk to their physician there. So that has benefits over a site that's done once at a church. Again, I appreciate and value the interest, but I think that's not the best way to go to maintain and improve access to testing over the long term. The ultimate solution to improving access to testing is getting more of these materials.
All right. Thank you very much.
Thank you, Manny. We have a few minutes now for a quick second round. We'll go back to Sean Walsh of the Inquirer.
Thanks. Dr. Farley, I may have missed it, but I don't believe you shared the percent of hospital beds and ICU beds in Philly and the region that are occupied.
I didn't. I get back to it's roughly 33% of hospital beds, of the general beds, and I believe a little less than 30% of intensive care unit beds. So similar numbers to what we had before.
That's available or occupied? Available.
That's available.
And that's for the city or the region?
That's for the entire region.
Okay. And in the city, do you have specific numbers for that?
I don't have that for you.
Okay. Thanks very much.
Sean, we'll try to get that for you when we can. Did you have anything else?
No, that's it.
All right. Let's go back to Pat Loeb of KYW.
Thanks. And one more question about when inmates are discharged after early release hearings. Are they given any special instructions about quarantining themselves for 2 weeks after they leave?
Yes. So we do provide instructions to everyone who is discharged to quarantine, to isolate, what they should do if they feel sick or have symptoms, continue to wear masks. So yes, we do provide information to inmates upon release.
Thank you.
Pat, are you good?
Yes, thanks.
All right. And there are no further hands raised for questions. So with that, thank you for joining us. We will conclude today's briefing and rejoin you again at 1 p.m. tomorrow. Thanks.